Hi, this is Sharon, and I wanted to go over with you today about the type of treatments that are available for ovarian cancer. So let's say you've exhausted every measure to have the screening done for ovarian cancer, and God forbid you find out, okay, I've been diagnosed with ovarian cancer. So what does that mean for me? I'll tell you what it meant for me. And there are several types of treatments for your ovarian cancer. Being that usually the ovaries are the source of the problem, surgery is going to be the first line of defense against this particular cancer. They have to be removed. That means emergency surgery or an emergency hysterectomy. Now, there are various means and ways of removing the problematic areas of your organs. They even have some that are done laparoscopically, but that's very, very, very rare. Particularly if you're in a stage where the cancer is very late and you have to remove the source of the problem. So that means surgery. So for me, it was surgery. They had to open me up literally. They performed what we call somewhat of a oophorectomy, and that means that they removed not only the ovaries, the fallopian tubes, the uterus, which had fibroids, my uterus had fibroids, the cervix. So when it's removed that completely, it's usually referred to as an oophorectomy. They've removed almost everything that they can remove. For me, definitely the ovaries had to go. Definitely surgery was the wage that we had to take against it, because when they did the scans, they saw that my little ovaries that should have been like this little, like little almond size, were gigantic. They were huge. Something that should have been the size of almonds were like right ovary, 7 inches in diameter. Hello. Left ovary, 4 inches in diameter. Hello. Not good. How they existed in my body, I have no idea. But there you are. So surgery is usually the first thing that you have to undergo because you've got to remove them. It gives the doctor, the oncologist, a very good means to see what's happening in your body. You want a gynecologic oncologist slash surgeon doing this particular procedure, because you need to have someone there who knows exactly what they're doing. They need to know what to look for. This is the type of doctor that you would prefer having performing this particular surgery on. I really believe it's the reason my life has been extended so much more, and my mortality rate has gone on as long as it has, because I had a gynecologic oncologist who performed my surgery. During the surgery, there's a procedure that they call debulking, and it's exactly how it sounds. While they were inside of me, every bit of cancer that they could see, they removed. They debulked from my body. It was a great opportunity for them to get it all while they could. So not only did they remove my, like I said, the ovaries, the uterus, the cervix, the fallopian tubes, but they also removed about 12 to 13 lymph nodes. They could see them. They could see how large the lymph nodes had gotten, and they knew that the cancer was in them. So while they had that opportunity, they removed the lymph nodes as well. And I'm so glad they did. Once I was stitched up, they prepared me for a procedure to implant a port. The port is the mean that allowed them to administer chemotherapy, which is the next treatment. But the port was implanted in me about 2 weeks after I had my surgery. So 2 weeks after the surgery, I had to heal a little bit, and then there I was right there getting this little port implanted. It was implanted, mine was implanted on the upper right side of my chest. You can see that scar there. That's how they cut it to insert it. And then you see that little dot there. That's where the needle is always accessed from all the many countless times that I had to have chemo. This was a direct line into my body for the chemo to be administered. I'm so glad it's there. I used to hate it being there, but now it is literally my lifeline, and I can't imagine life without it. There is another form that they use also that they implant into our abdomens, and they administer it, the chemo, into your directly into the abdomen, which would make more sense. But again, it depends, I think, on the patient, the stage, the condition of the patient's body. All of those factors come into play. For whatever reason, and I don't question it, my doctor saw more better fitting to have mine here. I haven't had a problem with it, knock on wood. I get it flushed, the port, about once a month, once every 2 months, but it should be once a month. And then after the port was implanted, I began my chemotherapy. The chemotherapy was administered to me about once every 3 weeks for about 8 to 10 months. So I was having chemotherapy treatments once every 3 weeks for about 8 months. And it was upon that my numbers had come down to the remission status level, and so I was in remission for a good while, for about a year and a month, until my subsequent lab work showed that my numbers were going up again, and there I was again doing more chemotherapy. And I'll go into more details about the side effects of the chemotherapy for me, but right now I'm just wanting you to know what the treatments can be. So you've got surgery, most optimal. Then you have, usually chemo follows, and sometimes before the surgery they may administer the chemo. Again, it's based on the patient's body, what the condition is of their body, and if it's most ideal, then the surgery. So sometimes they'll do chemo and surgery, or surgery following, or surgery and then chemo following. It just depends, but there are definitely two tools that are used. After that, they have hormone therapy that helps many women. Some of the hormonal drugs are also utilized with women of patients who are breast cancer patients. And if it works for the ovarian cancer patient, then it's a very optimal thing. Number 4, they have radiation. It's kind of rare also, but if it can be spot treated, and I just went through that, so I'll have to go into the side effects of that for you too. But again, like I said, I'm just listing the treatments that you can expect. So radiation was one. And they have another type. They have the holistic approach that many people opt to take. That's a very personal thing, and it scares me a little bit because I feel like God gave these doctors the knowledge to help us. So I can get into holistic approach, but I feel like if it's to be used, please use it in conjunction with the treatment that your doctor insists you have. It could be a questionable thing. I opted not to do so because I didn't want to have anything affecting my treatments. I didn't want to have any variances throwing things off. So for me, it was a personal choice, but there are those alternative medicine issues. So here you go. You have surgery, chemo, you have hormonal therapy, you have radiation, alternative therapies. There's tons of them out there, trust me. And then you have what we call palliative care, which means you're just going to make the body comfortable after you've exhausted all other means to conquer your cancer. And that's usually at the very end of your cancer journey, and you're just looking into just having a very comfortable stage to go away in. So hopefully we don't have to get to that point, and that's why I'm doing this today. So there you have it. You have surgery, chemo, you have hormones, you have radiation, and lots of alternative things out there, but that's a very personal choice. I will come back again, ladies, with more info. I'll go into the side effects, or at least how the chemotherapy and the radiation affected me. I think you're going to find it quite interesting, but I'm glad you all checked in as usual. Keep the questions coming. I'm really appreciating your comments and calls and things of that nature. So love you. I'll talk to you again soon. And I'm Sharon, and I'm just happy to be. Take care now. Bye.